A discussion on the global healthcare crisis took place during the Human Rights and Humanitarian Forum in Los Angeles in May 2024. Organized by the Aurora Humanitarian Initiative in partnership with UCLA's The Promise Institute for Human Rights, the conversation was moderated by Alice Park, Senior Health Correspondent at Time. Panelists include recording artist and biotech entrepreneur and co-founder of Major Inc., Aloe Blacc, CEO of Catholic Medical Mission Board, Beth Powers, UN Special Rapporteur on the Rights to Health, Tlaleng Mofokeng, Director at USC's Institute on Inequalities in Global Health, Sofia Gruskin, and CEO of Partners in Health, Sheila Davis.
And it is my pleasure to be moderating this session on the global health crisis.
The panel explored urgent challenges in global health care, including access to care, inequality, and the role of innovation and advocacy in creating sustainable solutions. Keynote speaker, UN Special Rapporteur on the Right to Health, Dr. Tlaleng Mofokeng, opened up the session by emphasizing how healthcare must be rooted in human rights, equity, and accountability.
Now, the realization of the right to health is more than just about the realization of access to in-facility care. But whether before or during or after a public health crisis, it requires all human rights to be fully embraced.
Dr. Mofokeng highlighted how structural inequalities worsen the pandemic's impact, leaving vulnerable populations disproportionately affected. She underscored the need for leaders to uphold international law and protect human rights, even during public health emergencies.
Decisions to suspend or curtail certain human rights in response to a pandemic must be made in accordance with international law, and the decision makers must always be held accountable.
Beth Powers, CEO of the Catholic Medical Mission Board, shared insights on the early days of the pandemic when shortages of personal protective equipment exposed the harsh inequities in global health systems. According to Powers, wealthier nations consumed the bulk of supplies, leaving lower-income countries to improvise. Even as vaccines became available, distribution challenges were exacerbated by inadequate planning and gaps in public health infrastructure.
And the systematic underinvestment in health systems and in public health systems in particular is, I think, probably the biggest problem and the greatest learning for us through the COVID epidemic.
CEO of Partners in Health, Sheila Davis, built on this, pointing to the lack of oxygen systems in many low-income countries. For her, this was one of the pandemic's most devastating failures, preventing critically ill patients from receiving even basic respiratory support.
The world really saw that the lack of oxygen was probably the biggest, resulted in the biggest mortality around the world, which was really unfortunate because it's cheap, it's easy, and that doesn't need a trained health professional.
Socioeconomic status became a determinant, once again, of who lived and who died.
Looking ahead, countries are working on a treaty to ensure everyone has access to healthcare and vaccines in future crises. However, according to Sofia Gruskin, a leading expert on global health and inequality, political disagreements are slowing down the process, raising questions about the treaty's potential to create meaningful changes.
Health is political, right? And we just have to admit that who has access to health is political. And the way that politics plays into this is something that is critical in terms of what happens on the ground, but it's also critical in terms of thinking what's happening with the treaty.
Gruskin pointed out that while some African nations have the infrastructure and expertise to produce vaccines, systemic barriers such as patent restrictions and limited access to raw materials undermine their ability to do so. These barriers, she explained, are a result of power imbalances in the global health system, where wealthier nations and corporations often control critical resources, hindering the efforts of low- and middle-income countries to become self-reliant.
Which every time it seems as though the product and the ability to be able to work with those products exists, they get pulled out, the rug gets pulled out from under.
Aloe Blacc, known for his music and philanthropy, brought a unique perspective as an artist and advocate, sharing how his work as an ambassador for organizations like Malaria No More has contributed to tangible progress in reducing child mortality.
I've seen, the rates of child death go from 1 every minute to 1 every 2 minutes, so halved. And that's because there has been a concerted effort in just lots of donations, new medicinal technologies, but also practices.
Blacc highlighted the importance of communication and collaboration across sectors and the role they play in raising awareness and advocating for under-addressed issues.
I love the role that I get to play in translating messages, and I want to be a voice to influence and inspire my peers to do the same.
I want to thank all of our panelists. I think it's clear we have a long way to go, but we saw some reasons to hope. So thank you very much.